I'm going to go ahead and get things started. Just so you all know, the way this is going to work is I am going to ask Dr. Cunningham a few questions just to get things sort of started and then open it up to you guys. So if you want, go ahead and virtually raise your hand and I'll call on you in the order in which I see your hands go up to the best of my ability. And that's basically how things will go at this point. We still have a few people joining. So just 1 second. If you would like the ability to record and you don't currently have it, let me know that as well in the chat. But Dennis, why don't you go ahead and start for us by saying your name and spelling it and giving us your title as well.
Sure. Dennis, D-E-N-N-I-S, Cunningham, C-U-N-N-I-N-G-H-A-M, and I'm the Assistant Medical Director for Infection Prevention at Henry Ford Health. And
he is also an MD, and any other letters you need?
No.
I know you don't need them, but you earned them, so we like to use them. Okay, Dr. Cunningham, if you could give us an update at this point of what we're seeing of the new variants of COVID-19 here in Michigan, and how does that compare to other parts of the country right now?
So the newest variant that's gotten a lot of attention is XBB.1.5. On the East Coast, we know that it's causing over 72% of COVID infections, particularly in the New York, New Jersey area. The CDC releases variant data for the regions of the country on Fridays. Last Friday, XBB.1.5 accounted for 14% of COVID cases in our area. So it's climbing, but it's still at a pretty low rate here. It just means we're behind the curve, and it will get to 70% here. I have no doubt. It's just a matter of when.
You got to something that I wanted to ask you, but what would your forecast, for lack of a better word, be in terms of our COVID situation here in Southeast and Central Michigan, both COVID in general, and then also the XBB variant for the next maybe week, 2 weeks, month?
So right now, we're doing great in Southeast Michigan. As a system, we have about 70 COVID patients across our 5 hospitals. I do think that number will increase over the next month as we see more of XBB.1.5. If you look at, again, the East Coast, they did have an increase in hospitalizations, nowhere near those peaks we saw early in COVID. So I don't expect anything that's going to overwhelm us or anything like those numbers when everything was pretty much shut down. But I think there'll be some increase in the next 3 to 4 weeks.
What are people experiencing in terms of symptoms or severity from the new variant?
The new variant, it's a lot of cough, congestion, headaches. So it's hard to tell, is it COVID, is it flu, or is it the common cold? And it's so important to get tested, because if a patient has flu or COVID, and especially if they have risk factors for more severe disease, it's important to know, because you can get medicine that will help prevent you and prevent you from getting worse and keep you out of the hospital. We have the COVID tests at home. We don't have that for flu right now, but it's easy enough to go to your doctor's office or a clinic and get tested.
Okay, so I do have a question in the chat from, looks like John at WWJ. So he is asking, when it comes to COVID variants, how far behind the curve are we? Meaning, by the time XBB.1.5 is identified, how long has it been circulating, and are there other as yet identified variants likely out there?
So this variant, it looks like it first came up in China. So it was circulating in China and then spread across the world. Around it hit the United States East Coast first. So, every variant's a little bit different, but I'd say generally, whatever they're seeing on the coast usually comes here for COVID in 4 to 6 weeks. Are there other variants out there? I have no doubt about it. They're not being mentioned right now. There's lots of variants. There's been hundreds, if not thousands. Most of them aren't very significant. They may be very mild, or they might not even cause much disease because they're not transmitted easily. It's pretty rare when you get one of these variants that is so contagious, like XBB.1.5.
So it's contagious, but it's not very severe / concerning. Is that a fair way to describe it?
So if you look, there was a slight uptake in mortality on the East Coast with this variant, not a whole lot. Increase in hospitalizations, again, not terrible. But the good news is that the bivalent booster still seems to be giving protection. New York City breaks down their cases, hospitalizations, and deaths, comparing vaccinated, unvaccinated, and then even within the vaccinated group, boosted versus not boosted. And any vaccine, regardless of booster, does seem to give pretty good protection against being hospitalized and being admitted. Being hospitalized or dying, and even to some extent lower case rates, showing the vaccines can help prevent infection, not just the severe cases.
Folks, if you have questions, go ahead and either put them in the chat or raise your hand. Otherwise, I'm just going to keep asking questions. Because old reporter habits die hard. But so Dennis, here's my thought on this, right? So gosh, we've been living with COVID for so long. What I'm hearing is what I just had in my last question, which was, it's not that severe, even though it spreads a lot. So why should we not treat this as any other flu virus, et cetera? Why do we need to continue to keep talking about these new variants? Is it important? Are we just spinning our wheels?
So for most people, you're going to have an illness, you'll be home, you'll feel crappy, you get better. If you have problems with your immune system, if you have longstanding heart or lung problems or cancer, you're at a much higher risk of coming into the hospital or dying. And, on average, if you look across the country, we have several hundred deaths a day, which is more than we typically see with flu or with other respiratory viruses. So even though the numbers are small, if you're in that high-risk group, a few hundred deaths a day becomes pretty significant. So from that point of view, I'm still a big fan of the vaccine. I'm glad that I had mine, including the bivalent booster, because it's that much more protection between me getting sick and coming into the hospital as a patient.
While we're on vaccines, I now understand that the bivalent booster is available for all ages. Can you talk about that and where we're at with the bivalent vaccine?
Yeah, it's approved now down to ages 6 months. So if you're 6 months of age or older, you're eligible for that vaccine. For children, if you're under 5 years of age, we give you 3 doses of the COVID vaccine. The first 2 doses are monovalent, meaning the initial vaccine that came out, and then your 3rd dose is the bivalent vaccine. So even young kids can get this bivalent vaccine, which is great. The main difference between the old vaccine, the one that came out originally, and these new bivalents is the bivalents were designed specifically against Omicron. And everything we're seeing now is Omicron. The BQ1s, the BF7s, the BN1s, the XBB, all of this is in the Omicron group.
Very good. A lot of people aren't masking anymore. What are your thoughts on that? And how do we protect ourselves?
I think everyone needs to make a decision for themselves. If you have bad lungs, a bad heart, if you have chronic medical conditions that mean you're more likely to get severely ill from flu or COVID, wear that mask. If you're healthy, that's certainly a decision that's up to the individual. If you live with people at high risk, it seems to me that mask would make a lot more sense. I like to wear the mask if I'm in the grocery store and it's crowded for my own peace of mind, but you don't have to.
Got it. What would you say we saw in terms of the holiday surge that we were sort of bracing ourselves for? To me, it doesn't seem like it's there. And if that's an accurate assessment, what does that tell us about the viruses and the way of the virus and the way that we're protected right now?
So we had a little bit of an increase in cases after Thanksgiving, but not really much after the winter holidays, Christmas, Hanukkah, New Year's. I think that's partly we didn't have much XBB around here. We have people who've been vaccinated who have some protection from this. So I think that's part of it, but I don't want people to get too relaxed because I do think we're going to see more cases as XBB.1.5 becomes more prevalent here.
Good. That is all the questions I have, Dennis. Do you have anything that you think I missed that you want to make sure that the community knows?
Well, we're still seeing a lot of flu. It's back down, but it's not too late to get a flu vaccine. And this year it's been great. The flu vaccine is an excellent match for what's circulating. So if there's a year to get the flu vaccine, this is the year.
Very good. Let me see. I do see another question here. So final question. No big deal. No big deal, John. Okay, final question from John. Will COVID variants like the flu essentially be a permanent part of our future each year? And in general, is it fair to look at vaccines not as preventative, but more as a way to limit severity of illness survivability moving forward?
So I don't see COVID going away anytime soon. I think we're going to be stuck with it for quite a while. There was just recently a report announced where they're starting to do human trials now for a universal COVID vaccine that would work against all the strains. That would be wonderful, but it's not here yet, and we don't know if it will work. The vaccines, they absolutely are great at preventing severe disease, hospitalizations, and deaths. They're not as effective at preventing any illness. So in that point of view, we're using the vaccine more to prevent severe disease than to prevent any cases. So it prevents the serious stuff, but even if you're vaccinated, it's likely you will have a mild case of COVID. I wish that would be different, but all I know is this virus has been unrelenting since it hit Michigan, I think in March of 2020, and it's certainly been surprising us.
Okay, well, not seeing any other questions, I'm going to go ahead and end this call. Dennis, would you mind, are you still available until 11:30 or so in case?
Yeah, I'm not going anywhere.
Okay, well, I'm going to end the call, but if somebody urgently needs us or is tuning in late, I might ping you. But otherwise, thanks everybody for tuning in, for joining us, and we appreciate you. Give me a ring or a call or an email if you need anything further. Okay.
Have a great day, everyone.
Dennis, thanks so much. You're a gem. Bye-bye.